Okay, a couple of add-ons to the other videos that we talked about, the keys to building a practice with Trigenics. One of the other keys to building a practice is getting into other areas that you may not have been in, or expanding upon those areas if you're already in them. And one area that's huge, I mean absolutely huge with Trigenics, is sports. Your ability to prevent athletes from having injuries is unbelievable. That doesn't sound like very much. It doesn't sound like very much to be able to say that you can prevent an athlete from having an injury. One would think that more important than that would be your ability to treat injuries. Well, guess what? And I think most of you understand this. That's not the case. The case is that Trigenics enables you to do your neurokinetic and your neuromotor, mioneural assessment, essentially, for improper neuromotor control and for showing the weak and short imbalance pull patterns on the various joints and parts of the body that create aberrant movement patterns that create pain. You're going to be able to go through that whole thing with the athlete even if they don't have any pain. And what's going to happen is in every single athlete that you do this on, and this should be done on every athlete, and then one day it will be, every athlete that you do this on is going to have a chart that looks like this, whether they have pain or not. Because every athlete is pushing themselves to the nth degree to be able to get that higher level, to be able to compete, to be able to be at the top of their game. And they're always stressing the body out in some type of an imbalanced way, which is creating neurokinetic imbalances all over the body. And it's only a matter of time with every athlete if there isn't somebody that is assessing these neuromotor deficiencies and correcting them as they train. It's only a matter of time before the athlete has an injury. What's the primary thing that stops athletes from getting to the top or achieving their goal or their personal best? Is injuries, period, end of story. You can treat those injuries effectively, and you can treat those imbalances effectively in such a way that you'll prevent injuries from occurring. The Estonian cross-country team, the physiotherapist that used Trigenics with that team before the Torino Olympics and the other Olympics since then, for 1 year prior to the Olympics, commented afterwards. He said, not only do every day we get a mini miracle with Trigenics, but this is the first year ever that we never had an overuse strain injury on the entire team. That was the year that they won 3 gold medals. I mean, this is going to be the biggest thing in sports that you can possibly imagine. Okay, that's prevention. Prevention's one thing. But treatment, being able to get the athlete back and get them functioning again, using the neurology of the body, retraining the brain, causing an instant neuroplastic change in that athlete that restores function almost immediately, enables the athlete's body to also heal. Where the tissue's been damaged, it allows for proper healing. And when that proper healing occurs, the athlete gets better a lot faster. It gets back in the return to play, back into the return to training, and back into the whole picture where they're actually still in the running and not knocked out of the running because of the fact that they've had to have 6 weeks or 8 weeks off for some injury. That doesn't happen with Trigenics. You can get them back. You can, with Trigenics, you can be on the sidelines. We had our, with our Olympic hockey team, we had Dr. Seymour Pizarnik on the sidelines actually treating an ankle through the skate, and that was the player that went on and actually scored the goal that won the game. She wasn't able to skate at all prior to the Trigenics. He worked on her literally through her skate, inside her skate, however it was. And we have all kinds of stories like that. I mean, we've got stories from doctors that treat football players and baseball players, all professionals, all kinds of stories where the athletes were treated on the sidelines. Well, but not only treating that, then it goes to a whole other level in sports. So it's so huge for sports. You can actually treat, assess, and we've got assessments already done for various sports where you assess which muscles need to be elongated, which need to be strengthened in order, in an almost imbalanced way, in order for them to gain more momentum, more power, more speed in the specific movement pattern that they need to be able to do to get the most out of their sport and to be able to actually throw or run or whatever it is at the absolute peak potential. This type of treatment, this power augmentation treatment, Trigenics, can be done right before they compete. So you're going to have Trigenics right on the sidelines. You're going to have Trigenics right on the sidelines as the batter is about to go out. You're doing that power augmentation Trigenics on them before they go out and hit the bat or kick the ball or throw the ball or whatever it may be. This is just huge for sports, and not only that, there's even other bigger things coming to have to do with power augmentation. Not only power augmentation, but hypertrophy and growth of muscles. It's unbelievable. It's unlimited. It's amazing. If you're in the sports world, try Trigenics. Definitely investigate it and try Trigenics on your athletes. You'll never look back. That's another way of building your practice with Trigenics.